Hi and Assalamualaikum. Today me and my friend will talk about tuberculosis, and in this presentation we will talk about introduction, symptoms, pathophysiology and treatment.
The highly infectious illness TB is caused by bacteria, microbacteria, tuberculosis, and tuberculosis, which has been present in nature for at least 1500 years. Tuberculosis has existed from the beginning of time. TB is caused by the bacteria, microbacteria, and tuberculosis. So are those tuberculosis bacteria are most commonly found in the lungs. They can also infect the kidney, spleen, and brain. Everyone who comes into contact with tuberculosis bacteria becomes sick. A sickness caused by a specific type of bacteria that spread via the air from one person to the next. TB may infect many regions of the body, but the lungs have the most commonly infected. TB symptoms may not develop for years, but they may occur when a patient gets ill with a severe illness such as diabetes, AIDS, and cancers. Antibiotics are typically used to treat and cure tuberculosis, also known as tuberculosis. Tuberculosis, TB, and infectious illness caused by specific kind of bacterium. Primarily affect the lungs. When infected, people cough, sneezes, or spit or viral spit via the air. TB can be prevented and treated according to estimate. The TB infection has infected around 1/4 of the world's population. Symptoms: when tuberculosis TB germs survive and multiply in the lungs, it is called a TB infection. A TB infection may be in one of three stages. Symptoms are different in each stage. So first, primary TB infections. The first stage is called the primary infection. So immune system cells find and captures the germs. The immune system may completely destroy the germs, but some captures genes may stay survive and multiply. Most people don't have symptoms during a primary infection. Some people may get flu-like symptoms, such as low fever, tiredness, and cough. For the latent TB infections, primary infection is usually followed by stage called latent TB infection. So immune system cells build a wall around lung tissue with TB germs. The germs can't do any more harm if the immune system keeps them under control. But the germs survive. There are no symptoms during latent TB infections. So during active TB disease, happen when the immune system can't control an infection. So the genes cause disease throughout the lungs or other parts of the body. So active TB disease may happen right after primary infections, but it usually happens after months of years of latent
Pathophysiology. The airborne infection disease known as tuberculosis is brought on by the microbacterium tuberculosis. The pulmonary alveoli or as lungs are the location of this infection site. Because antibiotics are not used in this infection immune response, which takes the form of cell-mediated immunity, the pathogen cannot be removed. To counteract this pathogen, there are various immune cell types, including macrophage and the chemicals this cell secrete. One of four outcomes is then possible after inhaling microbacterium. Microbacterium tuberculosis will first be immediately eliminated by macrophage and its chemical by which it is followed by right-away clearance of the organism. The second result is the onset of the disease, which means that the condition will spread throughout the lungs and become an active illness. Latent tuberculosis, a pathogen that is still active in the body but in a dormant state, is the third outcome. Last but not least, a disease that is active and will reactive over time. This result is a disease called reactivation that develops from latent tuberculosis to an active infective disease. Following that, cause of event depends on or is related to immune system function, malnutrition, aging childbirth, and immune compromise that are all factors that may have an impact on immune status. However, there is a some improvement in how this mycobacterium develop inside our bodies. The first symptom of this illness appear when the mycobacterium tuberculosis enter the pulmonary alveoli. The upper airway of our bodies are tubular, which push most bacteria into the mucus, which is removed fairly quickly. Sadly, despite this tubular environment, mycobacterium tuberculosis will stay into the lungs. The best place for this pathogen to live is in the alveoli for the reason there is a gas exchange there. It enter and remain in the alveolar macrophage in the pulmonary alveoli. Pathogens are captured into cells through a process called phagocytosis when they are found by macrophages. The cell is known as a phagosome in the case of Mycobacterium tuberculosis. During a topical immune system reaction, macrophages have lysosomes that contain hydrolytic enzymes that work to combine with phagosome to form a new structure called a phagolysosome. However, in the case of tuberculosis, phagosome formation and its function can be inhibited, so it cannot take place. As a result, Mycobacterium tuberculosis will persist in alveolar macrophage, replicate, and become the primary infection. Weeks will pass after that before immunity mediated by cells begin to wound. Immune cells encircle the injection site after this occurs. We refer to this condition as a granuloma at the infection site. Granuloma will reside in the necrosis or the death of the cell body. Gonococcal is the name for this condition. However, gonococcal is the term used when gonococcal for close to the lymph nodes. Following that, the gonococcal will gradually undergo fibrosis and calcify. The rank complete is the stage, then at the point either tuberculosis will be completely eradicated or it will progress to later tuberculosis, where the bacteria are still present but is a dormant stage. On the other hand, AJNX can weaken the immune system and cause later tuberculosis to become active. This accident is risky because it may activate the gonococcal which will lead to active tuberculosis. The infection may the spread to the one or both top lobes of the respiratory system. The upper lobes have a higher oxygenation level, which is why it spreads quickly there. Memory T cells release inflammatory mediators to regulate the new outbreak, which causes additional regions of causes necrosis because this pathogen remains in the body for a while. Once activities have found, bacteria may be able to spread to the other area of the lungs where the lymphatic system and airway, leading to bronchopneumonia. System military TB also has a potential to infect virtually every other tissue within the body by spreading to the vascular system.
Alright, now let's move to the treatment. Almost always, tuberculosis or TB for short can be cured with the right care. In order to kill the causing bacteria, doctor prescribe antibiotics. For 6 to 9 months, you must take them. The medication you take and the length of time you must take them depend on which cure your TB. Antibiotics used to treat the illness occasionally fail to cure it. This type of tuberculosis is referred to as drug resistant by medical professionals. If you have this type of the disease, you might need to take stronger drugs for a longer period of time. Latent TB treatment. Latent and active TB are the two types. Latent TB can reactivate and result in active infection depending on your risk factor. For this reason, just in case, your doctor may recommend medication to kill the dormant bacteria. The 3 available treatments are as follows. Isoniazid, the most widely used treatment for latent TB. For 9 months, you typically take 1 isoniazid antibiotic pill each day. Number 2, rifampin or rifadin. For 4 months, you must take this antibiotic every day. If you experience side effect or INH is not recommended for you, this is an option. isoniazid, and rifampicin. Under the guidance of your doctor, you should take both of these antibiotics once every week for 3 months. Active TB treatment. You will need to take a variety of antibiotics for 6 to 9 months if you have this form of the disease. The most frequently prescribed drugs to treat it are these four: rifampicin, pyrazinamide, isoniazid, ethambutol. A test to determine which antibiotic will effectively treat the TB strain may be prescribed by the doctor. You will take 3 or 4 medications for 2 months depending on the findings. You will then take 2 medications for 4 to 7 months. After receiving treatment for a few weeks, you will likely begin to feel better. However, a doctor alone can determine whether you are still contagious. If not, you might be able to return to your regular activities. Treatment for drug resistant. Treatment of drug-resistant tuberculosis. A TB strain is considered to be drug-resistant if it does not respond to the standard TB treatments. As a result, you will receive treatment using a cocktail of potentially ineffective second-line medication. This medication will require longer-term use from you. You have multi-drug resistant TB if different types of medication are ineffective. A combination of medication must be taken for 20 to 30 months. First, fluoroquinolone antibiotics are among them. Second, streptomycin. 4. An injectable antibiotic like amikin. And the last one is recent antibiotic therapies include para-aminosalicylic acid, ethionamide, and bedaquiline. These are administered along with other prescription drugs. Bedaquiline and linezolid are combined with the novel medication pretorminate. These medications are still being studied by scientists. Extensively drug-resistant TB is a rare and dangerous form of the illness. This indicates that many common drugs such as isoniazid, rifampicin, fluoroquinolones, and at least one injectable antibiotic don't completely knock it out. According to research, it is curable between 30% and 50% of the time. Every drug that we take will have side effect, and this is treatment-related side effect. If you experience any of the following signs, contact your doctor right away. Lower abdominal pain, 3 or more days of fever, itchiness or a rash, nausea, vomiting, loss of appetite, yellowing of the skin or eyes, dark or brown urine, tingling, burning, numbness in the hands and feet, exhaustion, readily bruising or bleeding, dizziness, and dark or brown urine. Take your antibiotic as directed at all times. Even if you feel better, don't stop. The remaining germs in your body could adapt and develop drug resistance if you don't completely eradicate it. And the last one, the best cure is to prevent it. TB prevention. If you have active TB of the lung, you can spread the infection to other people. Your doctor will advise you to stay at home for the first few weeks of treatment until you are no longer contagious because of this. Avoid crowded areas and those with compromised immune system during that time, such as young children, the elderly, and HIV-positive individuals. If you have gas or need to visit the doctor, you must put on a special mask. Alternatively, out until the point where TB germs are no longer being expelled in your cough, your doctor may decide to hospitalize you. If you are unable to consistently take your medication,
don't have stable housing, or have a multi-drug-resistant strain of TB, you might need to stay in the hospital for a longer period of time. The intention is to stop the disease from spreading.
Alright, that's all from us for tuberculosis. Thank you.